what are the myths surrounding this, either the virus or the vaccine? Really, the vaccine is what people are talking most about. People love to kick the anthill all the time. And so I'm going to say there is a tremendous amount of misinformation, as always. But right now, I don't know if it has to do with the election year and everything at the same time. We're in the perfect storm. So one of the main myths about the vaccine is that it was rushed. And so people are appropriately cautious. I certainly can't argue that. Anything new, when I'm, as a prescriber, I wait a little while to prescribe some of the new medications. So it's hard for me to really criticize people who are cautious about the vaccine. My biggest issue with that is that I spend a lot of time caring for the elderly, and we're just losing a lot of elderly patients. And so to me, to get a vaccine up and running, we need to try and take advantage of it, simply for that fact, because we are kind of racing the clock. We really are. Especially if we don't know the people that make it through the infection, how many of them have natural immunity enough to withstand another round of the virus. We just don't know. So for that reason alone, I'm a strong advocate for it, and the numbers are showing that too. But was it rushed? Was it brought to market too quickly? Well, much more quickly than most other vaccines. That I have to grant you. However, as I mentioned in the past, we've been working on this for 30 years. And this is technology that has taken a long time to mature. It's not easy to take an mRNA molecule and just put it in solution. It just doesn't last long. So we had to learn how to package it, how to make it, and deliver it into in the right way in order to elicit a response. So there was a lot of work going on for years now that we didn't even think about. There was a lot of progress made during SARS and MERS. In fact, those viruses sort of, I'm not going to say they took care of themselves, but they became less of a problem. This coronavirus, again, it's the same family of viruses. This one has caused much more of a problem. So we quickly realized we had to continue to attack this problem. The other thing about whether or not this was rushed is that if you just look at the numbers of people that have been tested in both vaccines, it's tremendous. And so we have gone through the animal models that are used. There are ethics behind that we can talk about. People argue about all the time. But the animal models were reassuring. They moved to phase 1, phase 2, and phase 3, and they've all shown very encouraging results with nothing very scary as far as side effects. And so I've listened to people from the FDA, I've listened to national leaders, and they all agree that this is not a rushed product. This is a genetic material, right? So this vaccine is made from some genetic material. So can it alter my DNA? There are people that have been misinformed that this can happen. And the mechanism just really doesn't exist in this fashion because the messenger RNA doesn't get to the nucleus of the cell. And the nucleus of the cell is where our DNA is. That's where it's kept. That's where it's referenced from. And so it just never comes into contact. This molecule is out in the rest of the cell where all the machinery is, the manufacturing houses. So it's in the factory. It's not in the library. So the DNA is in the library. The factory floor, which is where messenger RNA goes. And it sort of gets put into the machines and churns out proteins until it's sort of spent, and then our body breaks down that mRNA. So it goes away. It's totally degraded by the body. So it's not affecting our own DNA. There are concerns about preservatives in the vaccine. People are worried that's why it has to be stored so cold. The cold is because, again, the molecule is just fragile, so it has to be stored in a cold fashion. But the preservatives aren't there. You can read the labels of both vaccines. There really are no preservatives to speak of. There are lipids, or fat molecules, that help stabilize this and sort of escort it into where the mRNA needs to be to have its effect. There are some concerns about whether or not this vaccine is safe during pregnancy. It hasn't been really studied in that fashion. There's no reason to think it's unsafe, but appropriately so, a lot of people are waiting until pregnancy is over to be vaccinated. The other concern is for miscarriage, and this has not been shown to cause miscarriages or anything of that nature. So unfortunately, we're just never really going to be brave enough to study new things in pregnant females. It's difficult to justify that. So that's not something that I think we'll really have a good answer to. There's one other thing that's worth talking about. Since we have the vaccines, everyone is asking, hey, the pandemic will be over soon. Unfortunately, we still have to wait. We still have our work cut out for us. It's easy for us to have a very U.S.-centric view, too, because that's just how we are, basically. You know, we tend to think about what's going on in our own backyard, but this really is a global effort. And so we have to hit the brakes a little bit until everybody has had their chance to get their public health systems in a position to implement these vaccines. They're not available everywhere right now. Other countries have other vaccines that they're utilizing. The two we have are also being used in Europe, probably in Canada. But there are other products out there. You know, other parts of Asia have their own vaccines. So we have to just wait for everyone to sort of have the same benefit that we're having right now. And even having said that, we're uncovering more logistical challenges all the time. It's not easy to immunize millions and millions of people in a short period of time, especially when we have to really fight the misinformation. We have to make sure that we're safe, so we had to wait for that. And then to get the logistics sorted out, it's not easy. We haven't even begun to talk about the healthcare finance part. No one's really talked about who's paying for the vaccines. You know, the government has given us assurances that it's not going to be an issue, but that's a major obstacle, especially if you talk about worldwide. I mean, there's so many people that don't have the access that we have here. We have to, with the international travel and all the global activity going on, we have to just wait. And so the pandemic isn't going to be over right away. But we've taken an important first step.